Dr. J here. So glad you could be with me today. Today we are learning about breathing and how can breathing transform your body and your mind. Okay, so breathing and learning how to breathe properly is really a lost art form, basically. And it has new science that supports it. So this is evidence-based information I'm giving you on learning how to breathe and to train your body into proper breathing techniques, right? Okay, so this is nasal breathing through your beautiful nose versus mouth breathing out in and out of your mouth all the time. For thousands and thousands and thousands of years, different cultures have done meditations and deep breathings, okay? And the deep breathing is, through your nose, of course, is in China, in Hindu, in even the yoga practices of today. But I'll tell you what, when you do the study of the word breath and spirit in the Bible, the spirit of the living God is the breath, the ruah of our life, okay? And God breathed into the nostrils of Adam, and life entered him. So just think about that. So breathing in and of itself is very spiritual, but it's also healing to the mind and body. So let's learn about it. And then let's begin to practice, because practice makes perfect, so to speak, right? Okay, so anyway, so the history there's that. Okay, so it's a lost art with new science that supports the need to do more nasal breathing versus mouth breathing. Okay, nasal breathing humidifies your air that you're pulling in. Nasal breathing pressurizes your air. Nasal breathing filters your air. Nasal breathing conditions the air so that when it reaches down into the lungs, okay, the first 50% of the nasal air, of the nasal to lung bronchioles, has no exchange, okay? It's not until you get into the deeper breathing that you get a higher oxygen O2 saturation. So that's what we're going for, right? Okay, versus when you mouth breathe, the lungs become a external organ, and you can still get oxygen that way, obviously, because we're all still alive. However, you won't be getting as much. Okay, 25 to 50% of the population around the globe are mouth breathers. All right, so I'm bringing you this information that's current, science-based, that you learn to do nasal breathing. So nasal breathing is when you breathe in through your nose and feel the expansion. You know, you're breathing in through your nose, using your concha up here in your nose, the cavity, your airway, your air pipe down into your beginning of your chest cavity, bronchioles, and then out into the lung tissue itself. So you take a deep breath in, and then you hold for 4 seconds, and then you slowly release for 6, okay? And get really good at it, okay? Just practice that. So at night when we sleep and we're a mouth breather, we are losing 20% of oxygen saturation. So think about if you snore, if you're a snorer, if you have sleep apnea, okay, so there's this whole training process that needs to be done to begin to slow your breathing down and make it deep and long through your nose and not shallow and short through your chest, okay? It's deep and long, okay? So the oxygenation comes into the tissue, right? Okay? And so when patients and studies with patients doing these things have been put into place, they've also been trained in chewing, okay? All right? So I say all that because when you chew, you're strengthening your airway, and you're using your masseter muscles in your beautiful cheekbones. And over time, when they did studies of bodies from the past in ancient times, I'd say about 400 years ago was the studies that these beautiful people had stronger jaw lines, teeth lines, the top maxillary muscles, their nasal passages were bigger, and that is because they chewed their food more. So this day and age we are in an industrialized revolution where everything's on the shelf, it's gummy. As soon as it gets moist, you just swallow it. You lose the art of chewing. So that's why in most of what I talk about, you want nutrient-dense foods, you want to chew them up, because when you sit and eat, it's rest and digest, because you flip off the sympathetic nervous system that goes da 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 da, and you come into rest with the parasympathetic nervous system. So you incorporate that on top of deep breathing. The gentleman that wrote the book Breathe, his name's James Nestor. It's a great read. He has got tons of research in the back of it too. He had a CAT scan before he started these new practices in 1 year, beginning of 1 year, at the end of 1 year. And so he learned how to chew his food, did all of his breathing techniques, and at the end, his air passages grew 15 to 20%. Think about that, the strength of your throat muscles and your nasal passages. He had a release of all this mucus out of his nose and granules and all of this kind of things. And then his maxillary muscles specifically grew in strength, I think it was 5 pennies worth of thickness. That's how much bone grew here by learning to chew. And then it strengthened his airway as well. And he had much more energy, he was much more cognizant, his brain and thinking went up. He had just notably, he used to have cold hands and cold feet. And so that oxygenation gets out to all your tissues because you're giving your body more O2, okay? So just by learning to nasal breathe, and so I want you to feel free to look at there's 3 different other videos on breathing that I put up, so please feel free to look at them so you can learn a little bit more about how to do it, how to measure it, in the privacy of your own home. And when looking at breathing in general, when you go to different medical facilities, okay, you go to specialists, so to speak, okay, because like I'm a chiropractor and my focus is on neuromuscular and joint health, okay? That's my focus. But I have to look at the body as a whole and how you are nutrient dense to really pull the gold out and see what you need. And a lot of people will go to cardiologists and pulmonary specialists and kidney specialists and endocrine specialists. And the idea is not to be a reductionist, but how the system works as a whole in just breathing and getting oxygen to the tissue. Okay, so we don't want to reduce the ability to breathe, but we want to enhance all the tissues. And when you become a better nasal breather through your nose, you will see things change. Okay, they've done tons of studies on asthmatics, okay, because asthmatics, then they live in fear because their system tightens down. They constrict and they can't breathe and they shallow breathe and they're not getting oxygen. It causes a panic attack and anxiety. Even people that have panic attacks without asthma, this will benefit you 110%. I mean 100%. There's no 110. But anyway, you get my point. Okay, so first of all, you'll have more energy. You'll be more energy efficient with how you move oxygen to your tissue. Bonus. Second, your heart, your beautiful heart, and the beats per minute will begin to slow down too, which is awesome. The systems overall of your body, because they're getting more O2, will be much more efficient and in greater harmony. Your diaphragm, like I said before, drops down. So you're using your diaphragm muscle stronger and it's pumping your lymphatics, so it's helping your immune system, and just overall more efficiency and much more efficiency and cognizance to affect the brain as well, okay? So that's some of the bonuses that happen to the system, okay? Now, medicine says that normal breathing patterns are 12 to 18 breaths per minute. That science will probably change as the normal because it's really up to 12, 6, 8, 12 breaths you will have. So when you increase to 12 breaths a minute, okay, you increase your lungs' ability to go to 70% saturation of O2. That's great. And if you do 6 deep breaths a minute, it goes to 85%. Now these are studies. This isn't, Jonat's not just making this stuff up, okay? This is real studies. So why wouldn't we learn to do deep breathing through our nose? Because I want enhanced oxygen uptake, don't you? Of course you do. We all do. And I just want to reiterate here that just normal, shallow, fast breathing, you're going to get 50% O2 uptake in just a regular breath because it's shallow. You're not expanding that lung field down, because at the bottom of the base of the lungs, because of gravity, all that blood is down in the lower cavities. Still in the higher, but not as dense as it is in the lower. So you're going to, when you use your entire chest expansion, you're going to get deeper O2, CO2 exchange. And what they have found is that in asthmatics is that the CO2 is way out of balance. And so we need the dynamic of both of them together working, okay? And so who doesn't want to be healthier and more efficient? So it's a call to action for you to learn how to not be a mouth breather. Now I want to add that in this book, Breath, and also in the Oxygen Advantage, that book by Paul McKeown, he's a guy out of London. Anyway, they learned that you can do mouth taping at night. So something as wide as a half of a stamp, piece of medical tape, put across your lips. You can buy mouth tape now. You can buy mouth tape that goes all the way around your mouth. That helps to keep it shut, but you can still open it, and it brings more of a conscious awareness. I'll put those links below too. But anyway, it's just to have fun with it. Now, if you are truly sick and you have real breathing issues, you don't want to tape your mouth shut at night. Let's just tape it during the day so you can begin to see what you need to do to change, okay? So for heaven's sakes, listen to your body and listen to the Holy Spirit talking to you, okay? Because he'll give you the wisdom you need to get there. Okay, so what I want you to take away with all of this, I've got so many notes, but I can't get it all in under 15 minutes all the time. So I want you to do a 30-day challenge on just breathing well over the beginning of the year or any month of this beautiful year. Take 30 days and just stop what you're doing and begin to learn to deep breathe through your nose. Okay? Because it takes practice. You don't just all of a sudden be a marathon runner. It takes time to build that, okay? Because I've seen it even when I go to the gym. People are breathing through their mouth all the time. You're supposed to when you're in the gym, you're supposed to breathe in through your nose and then out through your chest, okay? Because you're going to get the deeper breath and you need the oxygen to the tissue. So it's just, we're shallow breathers in general, okay? And again, when you are, I just want to remind you, if you clench your teeth all the time, that puts you in fight or flight, the sympathetic nervous system. When you chew your food, that puts you in rest and digest, and that matters to your body and how it performs, okay? So take time and learn to train yourself in proper breathing techniques. I'll have a little bit more on this coming up too, on meditation and breathing. So that'll be fun. It's great. It's going to be really great and very knowledgeable and very evidence-based as well. All right. Well, thank you for allowing me to help you take your next step together towards health. And everybody breathes. So there's probably not one person that can't benefit from the video. So be sure to share it. Be sure to subscribe and click on the bell to get reminders every week. Bless you. Enjoy your day.